So for DB09, they reported basically how tolerable did you find this treatment, and patients could rate that as or how bothered were you by the side effects?
Right.
Not at all, a little bit, somewhat, or a lot. And what we see is that it's pretty similar across the T-DXd versus THP arm. I've only seen it reported for the first 9 cycles or so. So I would be very interested in what happens over time for these patients who are going to be on therapy for an average of several years. But it is encouraging that, we're seeing very similar results there. The other thing that's been encouraging is the common side effects with T-DXd that a lot of us worry about, which at least in my practice is mostly nausea, appetite loss, this sort of blah feeling that patients get. What we see is that's not getting worse over time. If patients are having that, they have it at first, and it typically gets better as we manage it better. And then it's not worsening as they're on it long term. And for me, that was really reassuring, because when I first saw the DB09 data, that was my primary concern about using the regimen.
Yeah, I've noticed, I've looked at the data, it was presented by Mo Ramawi on the podium at San Antonio. And it's interesting that many of the side effects do extinguish with time. I guess patients get comfortable, they got better anti-medic plans,
Yeah.
The doctors are more engaged in providing palliative services after the initial blush of like, you got metastatic cancer, we got to get this under control. And you see these things stabilize. And it's remarkable, it doesn't keep deteriorating, it just sort of stays right there. But with the caveat that we've got only a handful of cycles, and we want to know what it looks like 2 years later,
Right.
which we don't quite have that yet.
Right,
Yeah.
right.
It doesn't look like the THP arm isn't remarkably less in many ways in terms of the overall global, is this therapy bothering you? It's actually in the ballpark, which is a little surprising when you think about THP.
And you would think that at least what I would have thought you would see is, since most people are giving probably 6 cycles, the majority of us are doing 6 cycles of a taxane, I would expect then kind of immediately after that for those patients to feel better. And again, we don't have longer term, but that's not what we see.
Right. Well, you can imagine persistent neuropathy will just rob you of a lot of quality of life as much as any nausea might. So, and at least with nausea, you can fix it. Peripheral neuropathy is tough to manage. So there's probably some subtle differences there that keep the side effect profile in THP higher than I think we acknowledge.
Yep. And I do think, a lot of us are using more and more T-DXd for many reasons in the community or in academics. And we've all gotten a lot better at managing it and also preparing patients. I'm definitely much better at preparing patients for how they're gonna feel and having a plan. I use a lot of olanzapine, which works very well with the drug, I find. And even dose reductions, or some of my patients who are worried, I start them a little bit lower and go up, which again, isn't standard. It's not what was done in the trial, but I think it's definitely been helping manage people who are going to be on the drug for a long time.
Yeah, I call it vitamin O at this point. It's just part of the package.